Hello, my name is Dennis Marion, and I am Deputy Secretary for the Office of Mental Health and Substance Abuse Services, which resides within the Pennsylvania Department of Human Services. It's a pleasure to be with you and have an opportunity to talk about the work our agency is engaged with that is intended to support youth and young adults in obtaining and maintaining competitive employment as they move on into life. One of the important things that when we think about employment for young folks and folks that are about to go through transition into the adult service system is what that is like from their side. So I've had the opportunity to talk with a number of individuals, young folks who have gone through that journey. And they shared with me some of the most challenging aspects of what it was like for them to seek employment. And the common items they identified were a sense that there was stigma and that there was stress that they had to grapple with on a regular basis as they were moving forward into employment. And I think that's important for us to recognize as employers or individuals that work with potential employers to help improve the environment in which these young folks will navigate. And that to the extent that OMSAS as the state agency for mental health services, as we work in communicating and educating the public about mental illness and the fact that individuals can and do recover and can be a productive and effective employee, that it's important for us to help employers understand what they can do to create a working environment that allows individuals to succeed and excel. And some of that is just to raise the knowledge level that employers have about mental illness and how it might manifest itself, that any working environment has a significant number of individuals within the workforce that probably undisclosed who have diagnosable mental illness and may have experienced treatment, but come to work every day, do their jobs very effectively, integrate well with others, and succeed in their vocational path. So what we have to do is to bolster the recognition among employers that employment is a real possibility and an important aspect of life for individuals with mental illness. So an important part of what OMSAS does is working with our managed care programs as well as our provider community is to make sure that employment is a regular part of treatment planning, that is part of the sort of the whole person approach to treatment and going beyond just responding and managing the symptoms of the illness, what can be done to help this individual do well and be well going forward beyond the initial treatment experience. And employment is an important ingredient there. So it's our hope that whatever provider of treatment services looks at those issues and those needs within the context of the treatment experience. But the other thing we've heard from young folks who have traversed this journey into the adult working world is what life was like for them. And what we heard on a regular basis is the role of a mentor or another key individual, whether it was a paid individual who's within the treatment environment, maybe it was a peer specialist, or another significant person outside the treatment, outside the treatment team, who was a steady source of and a listening ear to help the individual talk about what life is like as a new employee and what the sort of stresses and fears and concerns of being new to the working life was like, and to help sound out the problems and seek solutions, to help that individual who may have the mental health diagnosis, but now is still a whole person and involved in the workplace. And time and again, the role of this a mentor or another key person who provided knowledge, some experience maybe gained through their own journey forward, and support to help the individual in the new working world manage stress, solve problems, and feel comfortable working through this transition. As individuals in whatever our roles might be, working with young folks, OMSAS has the broad scale responsibility of trying to identify best pathways, best practices to help improve the likelihood of success for individuals coming out of treatment. But that's a partnership effort. So whether you're an employer yourself or coming out of an educational environment, that we look to make sure we're following good practice in terms of creating an environment that recognizes folks with illness may have some special needs, may be susceptible to levels of stress that other employees may not experience, that these individuals may not be fully comfortable talking about it in the new workforce or the new working environment, may not be comfortable sharing that need with a new supervisor. So I think together as an educational system, as a treatment system, as a support system, that we have got to find new and better ways to help individuals navigate through successfully. And that I think part of that is helping employers recognize that within their workforce, they will have individuals that have mental illness, that have been through treatment, and that may do better if there's an awareness and a recognition that undue stressors may have a negative impact on those individuals, and that there are ways to adjust the work environment to help folks succeed and be more productive employees.